of its kind drug to fight Alzheimer's was approved by the FDA. It's known as Leqembi and is the first drug to slow down the symptoms of Alzheimer's.
All right, so joining us now to talk more about this is Alzheimer's Association San Diego board member David Crean. David, thanks for joining us here. We certainly appreciate it.
Thank you. Happy Friday.
Yeah, you as well. Let's talk about who specifically this drug is for and how maybe it compares to other ones that have been put out there.
So who is it for? It's for patients who have mild cognitive impairment or mild dementia associated with Alzheimer's disease. And those patients need to have confirmation of amyloid beta. Big word,
yeah,
but it's protein plaques on the brain.
But early in the process.
Early in the process. Yeah. It's not later stage disorders, or it's not what you call asymptomatic or pre-symptomatic that have amyloid beta. That's actually going through testing right now.
Okay. David, how's it administered? Is it oral or is it an injection? How do they do that?
Yeah, right now it's a intravenous injection every 2 weeks, and that injection takes just about an hour. Patients are required to go to hospitals for the infusion or to infusion therapy centers.
Give us an idea of how it works. So for those who don't understand maybe how Alzheimer's affects your brain, affects your body, how does this work to counteract?
These are monoclonal antibodies. They're given through injection, intravenous injection, and they're attracted to plaque on the brain. And that is believed to be, it's like a fundamental biology. These plaques sit on the brain, they cause cognitive problems. And so when they're not taken care of, they just accumulate and you get a cognitive decline.
So this goes to the plaque and does what?
It starts to break it down. It's basically a protein plaque, and it starts to break that down.
This is said to be, it helps, slow it down. But can this stop Alzheimer's? Can this be a cure?
Right. Right now, it's not a cure, and it's not going to reverse. Right now, it's just delaying the progression, which is great for patients. They can spend a little bit more time, independent life, memories, all that. So it's not a cure.
Yeah.
Hopefully, we'll get there.
A lot of people are seeing really great results with this, and that's so hopeful. But what has the development of this drug been like? And it's been on the pipeline for quite some time.
Yeah, drug development takes a lot of time and a lot of money. So typically 7 to 10 years is a typical drug development time, and hundreds and hundreds of millions of dollars. So it's taken a long time to get to where we are.
So there's a lot of money that goes into these, which is why oftentimes they charge so much money. Let's talk about the previous drug. There's one a couple years ago that some people thought was rushed through.
Yes.
That was very expensive. Can you tell us what happened there and how it compares to Leqembi?
Yeah, so the drug was called Aduhelm or aducanumab. The price tag on that was $56,000. And
one per year per patient?
Yes.
Okay.
And the Center for Medicare and Medicaid said, no bueno. That's too expensive, and you didn't show enough real-world evidence or long-term safety data to cover it. So that was a real problem.
So a company could put in all this money, all this time, and gets to that point, and they're like, nope, sorry, and then that's it.
Yeah, it's not only about proving safety and efficacy, but who's going to pay for it. That's an important part of the stool here.
You've been following the progression of this drug for quite some time. Talk about your personal, obviously, interest in it.
My personal interest, my father has mild cognitive impairment. He's going to see his neurologist to see if he qualifies. So it's really important to me.
That's really hopeful. That gives people so much hope, as we try to cure this. I guess finding these drugs, is just one more step closer to finding something to fix it.
Absolutely, and there's just so much energy now behind this with the approvals, and there's a lot of different ways you can go ahead and try to attack the disorder, the fundamental biology. This is just the start of it. There's other mechanisms and ways to attack it, and so there's a lot of energy and great research going on, and I'm really excited about it. And the Alzheimer's Association, great advocates for really trying to support this area. So
before we let you go, David, I want to ask for those who don't quite understand, like your father has something that's obviously very difficult to deal with as a family member, and for him, can you just tell us what it's like for somebody who has Alzheimer's and how this might change that experience?
Yeah, I don't have it. I can only speak from the standpoint as a caregiver, as a loved one, family member. It's a terrible disease. It's terrible to see what my father's going through. Maybe not recognizing me, maybe having some memory issues on some really great things that he's done throughout his world, or not being able to manage his finances, maybe not having the ability to drive. That's terrible to sort of go through as a family member and as a patient. So I think it's actually harder on the family members and on the caregivers than on the patient themselves.
Because you have to sit there and watch it.
Yeah, it's really, it's difficult. He's not the man that I used to know,
Yeah.
that I looked up to, and I still look up to, but it's just very, very
Yeah,
different.
hopefully something like this can start to make a big difference in people's lives.
Absolutely.
Yeah. David, thank you so much for the insight. We always
Thank you.
appreciate you coming in and helping us understand it.
Thank you for inviting me in.
Thank
Got it.
you.
All right, if you want to learn more about what we just discussed today, you can visit our website, fox5sandiego.com. We've got some information there for you.